question and answer portion. We have a wireless mic for
Yes. Yeah. And the G-Jack.
Where is the presentation going to be? Up there?
Yeah, putting it here. Yeah.
Ready to rock and roll?
Hello and welcome, everyone. My name is Cheryl Osimo. I am the Executive Director of Massachusetts Breast Cancer Coalition and CAPE Coordinator for Silent Spring Institute. To everyone in the room and to those watching remotely, we are so happy and grateful to all of you for joining us. Today, you are going to hear about the initial findings of Massachusetts PFAS and your health study on Cape Cod and what they mean for you and your family. I would like to thank Barnstable Town Manager Mark Ells for being here and for all that he has done to support this study in Silent Spring Institute from the very beginning. As a resident of Barnstable myself, it comforts me to know that our town manager truly cares for the health and safety of this community and beyond. Thank you, Mark, for welcoming us to Town Hall today to help us to host this very important community event. Your unwavering support and deep commitment to the people you represent is truly impressive. Please welcome Barnstable Town Manager Mark Ells.
Well, good afternoon, everybody, and thank you very much for the kind words. And on behalf of the town of Barnstable, we welcome you to this community meeting. I wanted to thank the Mass PFAS and your health study team for the work you're doing and sharing it here, your preliminary findings today, but I'll leave that to Laurel to go into the details of. It's no coincidence, though, that the town of Barnstable has partnered with Silent Spring Institute for decades. Our core values focused on everyone should live in an environment that's safe and free from pollutants of concern is a foundational sort of relationship that we've had with Silent Spring since certainly my initial discussions with them. This study on PFAS helps us better to understand the impacts in drinking water that may affect the health of our adults and our children in our community and beyond. For those of you who are familiar with Barnstable, it's our mission to maintain a high quality of life for both our residents and our visitors. And certainly our water resources are a key part of that. It's essential to that quality of life. And I will note that though our drinking water in Hyannis is now free from PFAS contamination resulting from prompt action by our community to take the necessary steps to ensure safe drinking water, the concern regarding these and other emerging contaminants are ever present, and we need your assistance to stop the use of these products. I want to thank you. I want to thank the research and the efforts of your organizations to be able to advance a better knowledge and understanding of what's to come in your description. So thank you, and we are always proud to be a host of these events. Thank you.
Thank you, Mark. And our other town officials that are here with us, Captain Tara Summers from the ATSDR, our study team, our volunteers, and the media. Thank you for helping us get the word out there. And now I'm honored to introduce to you Dr. Laurel Shader. Dr. Shader is a senior scientist at Silent Spring Institute, where she leads the Institute's water quality research on PFAS and other contaminants of emerging concern. Dr. Shader is the principal investigator of the Massachusetts PFAS in Your Health study. As many of you know, this important study is investigating the relationship between PFAS contaminants in drinking water on Cape Cod and their potential effects on human health. It's also part of a national health study on PFAS funded by the Centers for Disease Control and Prevention. Dr. Shader began studying contaminants in drinking water on Cape Cod shortly after she joined Silent Spring Institute in 2009. As she was preparing to send her first batch of water samples from the Cape back to the lab for her analysis, she and her colleagues had the brilliant forethought to ask the lab to test the samples for PFAS as well. It turned out, to our surprise, that not only were PFAS widespread in Cape drinking water levels in Hyannis, but also at the highest in the state, in Hyannis. Sorry about that. We are enormously lucky to have been able to partner all these years with Dr. Shader, a talented and dedicated scientist and now world-renowned expert on PFAS in drinking water and everyday products. To help us address PFAS contamination in our community, to protect from future exposures, and to work with town officials and our town manager, Mark Els, to keep our drinking water safe. Please welcome Dr. Laurel Shader.
Great. Thank you so much, everyone, for coming today. First off, thank you very much to Cheryl Osimo, who I've had the privilege of working with for 15 years through Silent Spring Institute and Massachusetts Breast Cancer Coalition's close partnership. I can't thank her enough for all of her tremendous efforts to support recruitment for this study and for all of our other federally funded water quality research here on Cape Cod. Thank you to Town Manager Mark Els for hosting us today and for his long-standing commitment to supporting the work of Silent Spring Institute and to protecting people's health and water quality here on the Cape. Thanks to all of you for coming. Some of you are here in the room and some of you are watching online via Zoom, and we will have the opportunities for people to ask questions from Zoom and from here in the room as well at the conclusion of the presentation. I appreciate this opportunity to be here today to share an update about the Massachusetts PFAS and Your Health study. We'll be sharing the results of PFAS blood testing for the Hyannis community and comparing those results to the general population. And we'll also provide some updates about where our study is headed next. So I wanted to start by acknowledging all of the people that made this study possible. Usually I have my acknowledgments at the end, but I really want to emphasize that this kind of a study really takes so many different people contributing to the study in many different ways. So I'd like to acknowledge my other team members from Silent Spring Institute. Some of them are here today. Emily Heckel, who's our study coordinator, and Emma Ryan, a research assistant up here on my left, and Abby Blind, who's a postdoctoral fellow. You might have seen her recruiting here in Hyannis. And Cheryl Osimo is at Silent Spring Institute as well as at MBCC. The other members of our research team include researchers from the Harvard School of Public Health, including Tamara James Todd, who's the co-lead investigator on the study, Eastern Research Group, including Neda Gavelis, who's here in the room today as well, and our colleague Philippe Grandjean from the University of Southern Denmark. Our work here in Hyannis wouldn't have been possible without the partnership of Massachusetts Breast Cancer Coalition, including Cheryl and Betty Ann Beavis, who is one of our outstanding recruiters for this study. She's here at the back of the room. Part of this work also took place in the town of Ayer, west of Boston, and so we worked with a community group there called PACE, and some of you may be interested to know we'll be giving an update in Ayer. We'll also have a remote option there next Thursday, June 13th. We're also, part of our work also involves reconstructing past exposures to PFAS, and so for that work here in Hyannis, we're working with Tom Cambereri, and we are also doing this parallel work in Ayer as well. And then we had a fabulous team here in the Hyannis field office, just acknowledging people who are here in the room. Joan Owens, who was our amazing phlebotomist and made the process of getting a blood draw that much easier for all of our participants, as well as our other study office team members. I also, of course, want to thank the hundreds of people who took part in the study. We really, truly could not have done this work without people taking time out of their busy days to come to our study office, providing a blood sample, taking time to do the questionnaires, and getting their kids to do the same thing. So thanks to all of you who participated in the study. And then I also wanted to provide additional thanks. There's too many names to read. The people who really helped us in so many different ways, providing information, providing opportunities for us to recruit, and sharing this information with the communities. So thanks to everyone who helped support this work. So for today, I'm going to start off talking very quickly and broadly about what are PFAS. My guess is many of you are familiar with PFAS, but for those of you who are newer to the topic, I will talk briefly about what these chemicals are, where they come from, how we get exposed to them, and what are the health concerns. I'll talk about our study specifically here in Massachusetts, the Massachusetts PFAS and Your Health study, as well as the broader multi-site health study, of which ours was one of 7 subparts. Then I'm going to provide a summary of the PFAS blood levels for our participants here in Hyannis, and compare those to the general U.S. population, and talk about differences among different sectors of the Hyannis community. For those of you who took part in the study, you should have received a letter with your results, and if you didn't, please do let our study team know. For those of you who are in the study, we'll provide some additional information to help you interpret those results. If you weren't in the study, you might be interested to know how the results were received by individuals and how that information about individual PFAS blood test results can be interpreted. And then I'll end by talking about the study's next steps and some key takeaways. So PFAS is not one thing, it's not 10 things. It's a broad family of many different chemicals. By EPA's most recent estimate, over 14,000 different compounds are considered PFAS. PFAS stands for per and polyfluoroalkyl substances. Each PFAS chemical has a slightly different chemical structure, but the hallmark of a PFAS chemical is the carbon-fluorine bond, and these are some of the strongest bonds in organic chemistry, and that makes these chemicals really resistant to breakdown in the environment and in our bodies. That's why they've been called forever chemicals. They're also very mobile, so they've been found in rainwater, they've been found in ocean water, they've been found in the blood of indigenous communities in the Arctic, far from where the chemicals are used or manufactured, and in wildlife all around the world. So these really are global pollutants. They've been used in consumer products actually since the 1950s. Think of the old jingles for better living through chemistry. These are chemicals in Teflon pans and Gore-Tex jackets and Scotch-guarded carpets. So you might wonder why they have become such a concern in the past 10, 15 years if they've been in production for so long. Industry certainly knew for a long time about their harmful health effects, but it was only more recently that these really came to the attention of scientists and to regulators. That's due in part to community activism. For instance, in the West Virginia community near a DuPont plant that was shown in the film Dark Waters. And if you haven't seen that film, I would recommend it as a good introduction to the topic of PFAS. Also, due in large part to the widespread discovery of PFAS in drinking water supplies all across the country and all across the globe. I'm not going to get deeply into chemistry today, but for those of you who are more visual or have an interest in chemistry, I'm showing two structures in the upper right-hand corner of the slide. These are two of the most notorious PFAS chemicals, PFOS and PFOA. These are among the most frequently found chemicals in drinking water and in people's bodies. They are examples of what we call legacy PFAS. So they've actually been phased out of production here in the US and in Europe, although there still is some global production. They're what we call long-chain PFAS, because that blue zigzag in the middle, it's the carbon backbone, is relatively long compared to other variations of PFAS. So these are no longer manufactured in the US, and we'll see levels of these chemicals in the general population are going down, but they've been replaced with other PFAS chemicals, which raise many of the same concerns. So if you go to the store, you won't necessarily see PFAS on product labels, and so it can be difficult to know for sure which products contain PFAS. Some PFAS-containing products have trade names you might recognize: Gore-Tex, Scotchgard, Stainmaster, Oral-B Glide Dental Floss. Other types of products, it's more difficult to know if they have PFAS, but in general, things that are stain-resistant or waterproof tend to contain PFAS. Also, grease-proof food packaging, such as microwave popcorn bags, has contained PFAS, although FDA has changed their guidelines recently, and so it's likely that PFAS are being phased out of food packaging for the most part. They also show up in lots of other places you might not expect, such as cosmetics, floor and ski waxes, paints, rock climbing ropes, guitar strings. They're used in many everyday products, and so they can be very difficult to avoid, even for those of us who know a lot about PFAS. So we can be exposed to PFAS in many different ways. We are going to talk today about the past contamination of the Hyannis water system, and drinking water is one pathway where we can be exposed. But regardless of our source of drinking water, we can also be exposed through food, both from the food packaging but also from the food itself, because plants and animals can absorb PFAS from their surroundings, and PFAS can move their way up the food chain. One common source of PFAS contamination across the country is a certain class of firefighting foams called AFFF, which stands for aqueous film-forming foams. Many of the places across the country where high levels of PFAS have been found are near military bases, airports, or other fire chaining areas where these types of firefighting foams were used. They're specifically used for liquid fuel fires. So for instance, training for an airplane or an oil truck type of fire where there's flammable fuel, and other types of foams are not as effective for fighting those types of fires. High levels have also been found in industrial areas where these chemicals are manufactured or incorporated into products. And then the fact that PFAS are in so many products in our everyday lives means that we can also be exposed from the products themselves. There's the potential for PFAS to be absorbed through our skin. Some PFAS are volatile and can end up in the air that we breathe in. They can also end up in dust, and all of us ingest some small amount of dust every day. And if you happen to be a child and you spend a lot of time on the ground and put your hands in your mouth a lot, children are likely to have relatively high exposures given those behaviors and their smaller body weight. So not surprisingly, because of the widespread use of PFAS in consumer products and the prevalence in food, exposures to PFAS are widespread. So according to testing conducted by the CDC, and I'll talk a little bit more about this study later in the presentation, PFAS have been found in the blood of over 99% of people in the US who've had their blood tested by the CDC. Some PFAS, as I've mentioned earlier, PFAS and PFOA, are examples of long-chain PFAS, and one of the big concerns about these chemicals is that they have what we call a long human half-life. So they can circulate in our blood for years. Eventually the levels will go down, but it takes a long time for our body to clear these long-chain PFAS chemicals. I mentioned that industry has moved towards other types of PFAS, so some are short chain or some different variations of the chemistry. These that have been studied have more moderate half-lives in the body, so weeks to months, which is better than years, but it's still quite a long time considering that other types of chemicals can be cleared from our body in hours. And then for other types of PFAS, we don't really know about how long they can stay in our bodies. And then you might wonder, well, who's more likely to have PFAS in their blood or at a higher level? And so there are some general predictors of PFAS in people's blood. So one is age. So among adults in general, older adults tend to have higher levels than younger adults, and that's because these chemicals can accumulate in our bodies over time. For kids, sometimes we can actually see the opposite trend, where sometimes infants and younger children have higher levels. PFAS do get passed along through breast milk and during pregnancy, so the youngest children might have higher levels than older children. Gender is another factor. So in general, men have higher levels than women. Women, because PFAS bind to proteins in our blood, women can lose PFAS from their bodies through menstruation. Also, because PFAS can be passed along during pregnancy and breastfeeding, that means that PFAS have a way to leave women's bodies. Unfortunately, it does mean that the next generation gets exposed. These differences become less important in postmenopausal years, where men and women's levels are more similar. And then occupation is another important factor as well. For instance, people who work in factories where PFAS are manufactured, or people who use fluorinated ski waxes, or firefighters who have PFAS in some of their turnout gear, so their protective equipment, as well as in the firefighting foams, can also have higher exposures. And all of this put together is very concerning because exposures to PFAS chemicals have been linked to many different types of harmful health effects. For instance, exposures to PFAS have been linked to increased cholesterol and increased risk of obesity. PFAS have very consistently been linked to effects on the immune system, in particular reduced antibody production by children who have higher levels of PFAS in their blood. This is some of the important work done by our colleague Philippe Grandjean from the University of Southern Denmark. PFAS can affect thyroid hormone levels and liver enzyme levels. There can be reproductive effects such as preeclampsia, which is high blood pressure during pregnancy, and decreased fertility. There are developmental effects such as small decreases in birth weight and changes in bone density. Of concern for us at Silent Spring Institute, as an organization focused on understanding environmental causes of breast cancer, we're concerned that animal studies have shown impaired mammary gland development related to certain PFAS chemicals, and we think this is a potential sign that PFAS could raise breast cancer risk. And then other types of cancer, such as testicular and kidney cancer, have also been linked to high PFAS exposures. So there's a lot that we do know about how PFAS can affect our health, but there's still a lot that we have to learn as well. And one way that we can learn about how PFAS can affect our health is to work with communities that have experienced PFAS contamination. So as Cheryl mentioned at the beginning, Silent Spring Institute began testing for PFAS as part of a broader study of emerging contaminants here in Cape Cod drinking water. And from that early work, we were the first to test for and to find PFAS in public water supplies on the Cape. We also subsequently found them in private wells across Cape Cod as well. From that early testing, the levels in Hyannis did stand out as higher than other communities on the Cape. And this was amplified by later testing that the town conducted as part of a program called the UCMR3 program. So this was a nationwide set of testing required by the EPA for all large water systems with over 10,000 customers and a subset of small water systems. From that testing, we learned that Hyannis had higher levels of PFAS than any other public water supply in Massachusetts at that time. The main source of PFAS contamination here in Hyannis is AFFF firefighting foams, notably from the Barnstable County Fire Training Academy. These firefighting foams were also used at Barnstable Municipal Airport, which I realize has a new name now, the Gateway Airport. Fortunately, the town stepped up and put in place treatment to make sure that the water was meeting state and federal guidelines. When we started this work, there were no federal drinking water standards. There were only guidelines, which were not enforceable. So starting in 2016, Hyannis installed treatment to filter out PFAS from the tap water here. And one thing I really want to emphasize is that now all of the tap water from all of the municipal wells throughout the town is now filtered to remove PFAS. So that's really important news to know. The water is now being filtered to remove PFAS, but there still are lingering concerns about past exposures, and there's an opportunity to learn from those past exposures. So that I'm going to move now to talk about our study, the Massachusetts PFAS in Your Health study, to provide an overview of the study goals and how it fits within the broader study that's being funded and coordinated by the CDC. So the Centers for Disease Control and Prevention and their sister agency, the Agency for Toxic Substances and Disease Registry, or ATSDR, put out a call for proposals in 2019 for research teams to work with local communities that had experienced water contamination. I want to recognize Tara Summers and Chris Mugford from ATSDR. Thank you for coming down today. If there are any hard questions about ATSDR, I'm putting them your way. The vision for the multi-site study was to combine information from multiple communities in different parts of the country. Hyannis is a fairly small community, and a lot of the communities where there's been PFAS contamination are fairly small, and so it's difficult to do a big public health study, or what we call an epidemiological study, where we try to look for links between chemical exposures and health outcomes when the community is fairly small. So the vision for the multi-site study was to include communities in different places, and in the end to have a larger study population that would allow us to answer more questions. So the big picture goal for the study is to improve our understanding of PFAS-related health effects. And the goal, the target study population size, was 7,000 adults and 2,100 children. So Silent Spring Institute submitted a proposal to be part of this study. Research teams in other states did as well, and we were grateful to be one of the 7 teams selected to be part of this multi-site study. You can see on the map where the other sites are located. So our study is called the Massachusetts PFAS in Your Health study, and for this we're working with 2 communities. So Hyannis was one of the communities. We had been working on the Cape for nearly 30 years, and as I said, Hyannis previously had the highest levels of PFAS here in Massachusetts. In order to increase the number of or the size of eligible participants, we wanted to include a second community, and around that time we became acquainted with the community group called PACE in the town of Ayer, which is west of Boston. It was another community where the public water supply had been contaminated by firefighting foams, not to the same level here in Hyannis, but a similar source of contamination. So our 2 communities are Hyannis and Ayer. And our goal, set by CDC and ATSDR, was to recruit 1,000 adults and 300 children for both communities combined. Here for the Hyannis part of the study, we aim to recruit both current and former residents of Hyannis. So people didn't have to live in Hyannis at the time of the study to be eligible, as long as they had lived here previously. And I've previously mentioned our research partners at Harvard and Eastern Research Group and our local community partner, NBCC. So I learned a lot about how to do this type of a study, and I've learned that it takes a lot of work to get the word out in the community about a study. People can't just hear about it once and come in. They need to hear about it many different ways. And so it really took a tremendous amount of effort to get the word out in the community, to encourage people to sign up and to learn about the importance of the study. So I wanted to share some of the ways that we reached out to people in the community. So we sent multiple rounds of postcards to all Hyannis addresses. We did tabling at local events, at grocery stores, at the Cape Cod Mall, any opportunity where there were people coming together. We wanted to have the chance to talk with them about the study. We printed lawn signs and posted them around town. We did some door-to-door canvassing, so you might have seen us at your door or gotten a door hanger if you weren't home when we came by. We engaged with community leaders, so our elected officials. We had an open house at our former office space on Main Street in Hyannis. We're grateful to the town of Barnstable for their efforts to get the word out to residents here in the town. We're grateful to local news reporters for sharing information about the study as well. And then we put information out on social media as well. Silent Spring Institute and MBCC shared information, as well as our own study social media channels. So just to tell you a little bit about who was eligible to take part in the study. So we were looking for both adults, ages 18 and up, as well as children, ages 4 to 17. Because the focus of the study was on the drinking water in Hyannis when the levels used to be higher, so before 2016, we were looking for people who lived in Hyannis before July of 2016. After that point, all of the wells were in compliance with a standard or a guideline that EPA had put in place in May of 2016. The levels of PFAS in a person's blood is a marker of their exposure. Over time, the levels of PFAS in our blood do go down. So if someone had lived in the town 50 years ago, we wouldn't be able to necessarily detect any PFAS in their blood from that early exposure if they had moved away. So we needed people to have lived within the study area, roughly within the past 15 years. So that's how we ended up with our criteria of having lived in Hyannis anytime between May 2006 and July of 2016, generally at least for a month. So we had some people who lived here for a little bit of time and people who lived here that whole time. And then children could be eligible if they lived here during that period of time, or if their mothers had lived here during that period of time prior to the child's birth. Again, we know that PFAS can be passed along during pregnancy and breastfeeding. So as I said, people don't have to have lived in the town at the time of the study, so former residents were eligible if they met the criteria of when they had lived here. And as many people who were eligible within a household could participate. Because the focus was on exposures from drinking water, and part of our work will involve recreating past exposures based on water consumption patterns and where people have lived, were not able to include people who might have had elevated on-the-job exposures, so including firefighters and workers at PFAS industrial facilities. So just to give you a flavor for those of you who weren't part of our study, what it takes to be a participant in a study such as this. So for people who expressed an interest in the study, we had a quick screening questionnaire that we did by phone to make sure they met our eligibility criteria. We had a study office first on Main Street in Hyannis, and then we had to move because the office was being renovated, so we moved in the other direction on to Falmouth Road, just over the line in Centerville. So when people came to our office, we went through an informed consent process so they could learn about what the study was about and understand their rights as a participant. They provided a blood and urine sample, and we did some body measurements. Some are routine, like height, weight, and blood pressure. We had a special scale called the Tanita scale that also told us about body composition to provide additional measures about not just BMI, but additional measures about body composition. And then we had a subsequent questionnaire that we did by phone. We had questions about where people had lived and worked over time, questions about their water consumption, again, because we'll attempt to understand or estimate people's past exposure based on where they lived and their water intake. We also added some questions about diet and consumer products to try to get a handle on the other pathways of exposure as well. And then we had some questions about people's health history, so self-reported health conditions and medications that people reported taking. And then for children ages 5 to 17, we asked parents and guardians to bring their children back for a second set of neurobehavioral tests. So these included vocabulary exercises, drawing, and puzzles. So these are designed to assess things like ADHD, IQ, and executive function. So what are we actually testing for? So each participant blood sample, or so for each participant, we sent a sample of their blood to the CDC lab in Atlanta to be tested for 7 different PFAS chemicals, and this is a marker of exposure. If you've ingested more PFAS over time, you are likely to have higher PFAS in your blood. We also ran some more routine lab tests at LabCorp. Some of these are things that you might ordinarily have as part of your well visit checkups. And some of these are less commonly tested for as part of routine healthcare. So things like cholesterol, blood sugar, thyroid hormone levels, liver enzymes, and others. And then for our Massachusetts site, we also added on some additional types of analyses beyond the ones that are being conducted for all 7 sites. We're looking for additional PFAS chemicals beyond the 7 that are tested for by the CDC lab. We're running what's called metabolomics. So this tells us a little bit more about changes in specific biochemical pathways to help us understand how these chemicals are acting in a way that's toxic in our bodies. And then we're also going to measure COVID antibody levels as well, again, because of concerns about immune system toxicity related to PFAS exposures. So to place this within a kind of broader timeline, again, the call for proposals came out early in 2019. We found out late 2019 that we were going to be part of the study. Then COVID happened, so not surprisingly, that did slow things down quite a bit, particularly for our colleagues at CDC and ATSTR. So it took about 2 years for all the study protocols to be approved and to get the green light to launch recruitment, which we started in November of 2021. We launched recruitment in our other community in Air a year later. We kept going here in Hyannis to maximize the number of people to sign up for the study. And then all sites had to wrap up data collection at the end of last September, 2023. So now we're in June 2024. This is an initial meeting to provide an update to the community about what we've learned so far and to share that there will be much more work to do to continue analyzing the data, and we will provide future updates to the community as well. So in terms of how we did with our recruitment, so these were the enrollment numbers at the end, as of the end of September 2023. The final numbers will be a bit different than this. And on the bottom there, I'm showing the size of the communities. I did want to note that our 2 communities combined were quite a bit smaller than some of the other sites that had a much larger study area that they could pull from. So in the end, we had nearly 700 adults and almost 100 children take part in our study. And compared to the other sites, given all the challenges we had in our small communities, I'm really proud of all that we were able to accomplish. We were right in the middle of how all the other sites did with adults, and we actually had the 2nd highest number of children take part in our study. And it's really, again, thanks to the community for stepping up and being willing to be part of our study. And then what the numbers I just showed were for Hyannis and Air combined. So just to break those numbers down a little bit. So we screened nearly 600 adults and 77 children, or we screened their parents, I guess. So not all of these people were actually eligible, and not all the people who were eligible actually were able to come in to complete their blood draw and questionnaire. But in the end, and after we filtered through all the questionnaires and verified that each of our participants was eligible for the study, we had 385 participants who were adults here in Hyannis and 41 children, and the rest of our study cohort came from Air. So thank you again to all the people who took part in the study here in Hyannis. So now, so for people who took part in the study, again, all of you should have received a letter with your own individual results. But what I wanted to share today is what we've learned about how the levels in aggregate here in Hyannis compare to Air and to the general U.S. population. So first, a little bit about the people, our study population here in Hyannis. So among our adults, the median age was 62 years. So we definitely had an older study population compared to the median age of adults in general. Our children ranged in age from 4 to 17, so the median kind of fell in the middle there, age 12. We had more than twice as many women as men in the adult part of our study. The numbers were more balanced for the children who took part. In terms of race and ethnicity, among adults, the vast majority were non-Hispanic white, as well as some Hispanic, non-Hispanic black, and some non-Hispanic participants who fell into other categories or multiple race categories. Among our children, the cohort was a little bit more diverse, still a majority of non-Hispanic white, but we also had more Hispanic and non-Hispanic black participants as well. And I wanted to, before I show a table with a lot of data and statistical terms, I just wanted to get everyone on the same page about what we mean by things like median or 95th percentile. So I've used the word median already. So the median is the middle value. So when we're talking about age, the median age means that half of people are older, half of people are younger. When we're talking about PFAS blood levels, it means that half people have a higher level, half people have a lower level. The minimum is the lowest number, maximum is the highest, and then the 95th percentile is the level at which 5% of people have a higher level and 95% of people have a lower level. So I have a table with a summary for the results in Hyannis, and I will walk you through this, so don't be alarmed by all the numbers. Just a couple of things. So the units, so when we're talking about PFAS concentrations, the units that we're using are micrograms per liter. This is the same as nanograms per milliliter, which is also a common way to report blood test results for PFAS, and it's the same as parts per billion. So all three of those are interchangeable. Where you see anything that says like less than 0.1, that means that the lab did not find a detectable level of that chemical. So the minimum was often a non-detect. So that meant that participants didn't have a measurable level. It didn't mean they didn't have any of that chemical in their blood. It just wasn't found above the lowest level the lab could measure. So now I'm going to kind of walk you through this table. So we tested for 7 different PFAS chemicals. I mentioned PFAS and PFOA already, and there were 5 other chemicals as well. All of these are considered long-chain PFAS chemicals. And the first column there shows the percent of people that had that chemical detected in their blood. So the percentages ranged from 30% to 100%. So there were 4 chemicals that were found in nearly all of our participants, so PFAS, PFOA, PFHXS, which is a 6-carbon chain version of PFOS, and then PFNA, which is a lot like PFOA, but it has 9 instead of 8 carbons. So these were all found in over 98% of our participants, and most of the graphs that I'm going to show after this are going to focus just on these 4 chemicals. I know that the names of these chemicals all look pretty similar. They all start with PF. So just so that you know a little bit more about the differences between these chemicals. So PFOS and PFHXS are 2 PFAS that are typically found at higher levels, again, relative to the general population, in areas where firefighting foam is the source of contamination, because these are chemicals that were abundant in those Class B AFFF firefighting foams. And so what we saw in our participants was that these were the 2 chemicals that were present at the highest levels in our study participants. So just to walk you through some of these different columns here. So I'm showing now the median. Again, that's the middle value, and the 95th percentile. So that's the sort of upper 5% range. And we saw that PFOS and PFHXS were found at the highest levels, followed by PFOA and PFNA. So then we wanted to get a better understanding of how the PFAS levels varied among people of different ages and between people of different genders. And so what I'm showing here are the results for adults, broken into 3 categories by age, so 18 to 44, 45 to 64, and 65 and up. Consistent with other studies, we did see that the median levels did increase in older adults. So just comparing the oldest to the youngest group, the levels were 2 to 3 times higher in the oldest age group compared to the youngest age group. And then we also compared children, so ages 4 to 17, to the adults who took part in our study. And we did see, particularly for PFOS and PFHXS, that adults were about 3 to 4 times higher compared to children. For PFOA and PFNA, adults still had higher levels, although the adult levels were about 1.7 to 2 times higher than the children's levels. Again, this is consistent with what we'd expect given the accumulation of PFAS in people's bodies over the lifespan. And then comparing women to men, we did see that men levels of PFAS were slightly higher in men compared to women. in the general population, we might expect to see a bigger difference. Again, our study cohort was older, and so we, I think, had a disproportionately high percentage of postmenopausal women in our study, and we tend to see fewer differences between men and women in older adults. So this, again, is consistent with trends that have been observed in other communities. So now I want to compare the results from Hyannis to the general population, and I wanted to pause to explain, well, how do we know what the levels are in the general population? And a very helpful resource for understanding what are PFAS levels in the general population is a study called NHANES, which is the National Health and Nutrition Examination Survey. This is conducted by the CDC, and it's a representative sampling of around 5,000 U.S. residents that takes place every 2 years. And it's much bigger than PFAS. They ask all kinds of questions about health and diet, and they look for exposures to a range of different types of chemicals. So the most recent round of data that we had to compare our results to for adults came from testing conducted as part of NHANES from 2017 to 2018. So there's a little mismatch in time because our blood samples were collected from 2021 to 2023. I know that CDC had a disruption of NHANES because of the pandemic. So there are more recent blood samples, but we don't have more recent data. So I wanted to flag that because, as I'll show in the next slide, levels of PFAS in the general population have changed over time. So on this graph here, these are the results from different cycles of NHANES going back to 1999. And just visually, I just wanted to indicate that you can see that there's a downward trend over time. This has to do with the phase out of production of long-chain PFAS in the US. So you can see that once the exposures went down, that people's blood levels went down. It takes a while, but the levels did go down. Again, we don't have more recent data than the 2017 to 2018 cycle, but we can estimate and we can expect that the levels in the general population probably continue to go down. We just don't have the more recent NHANES data to know exactly how far the levels have continued to go down. Okay, so another graph here. Again, I'll walk you through the different parts of it. So what I'm showing here, so I'm focusing on those 4 PFAS that showed up most frequently in people's blood, so PFOS, PFHXS, PFOA, and PFNA. The blue bars show the results for Hyannis. The yellowy-orange bars are for air, our other community, and then the gray bars are NHANES results, so that's for the general population. I did want to note, so I mentioned that PFAS levels can increase with age, and I mentioned that we have an older study cohort compared to the general population. So if the water hadn't had any PFAS or elevated PFAS, we would still expect to see higher PFAS in our study participants because we had an older sampling. So it's important to take into account the different age distribution of our study population compared to the general population. So we're able to do that, and I won't get into the statistical details, but basically if we're doing an apples-to-apples comparison with a similar age distribution for Hyannis and air compared to the general population. This will tell us about exposures, not because of age differences, but because of different exposures in our 2 communities. So when we look at comparing Hyannis to the gray bars for NHANES, the greatest difference that we see is for PFHXS. The median in Hyannis was about 3.2 times higher than the median for the general population. That difference might actually be bigger because the NHANES data are from 2017 to 2018. We suspect that those levels are actually currently lower. So there might be a bigger difference, but we don't know for sure how much bigger the difference is. Moving over to PFOS, here we did see that the levels in Hyannis were somewhat above the median from NHANES from 2017 to 2018, but there was less of a difference. So the level was about 10% higher than for the general population. For PFOA and PFNA, which were present in the Hyannis water, but not at such high levels, we see that the median for Hyannis and for air both are more similar to the median for the general population. And same for the other three PFAS chemicals that we're not showing on the graph. Okay, and there will be time at the end to ask questions, but for now, I want to talk a little bit about, for individuals who've received results of PFAS blood testing, how to interpret those results. So for participants who took part in the study, they received a packet of information. There was a cover letter that explained the purpose of the study and what was included in the packet. There was a table with the individual's results. That's what I'm showing here, as well as some additional information for interpreting the results. And then we, as part of a separate Silent Spring-led study called PFAS REACH, developed clinical guidance for clinicians and for patients. For people who've been exposed to PFAS, we can't change those past exposures, but it can be helpful for medical providers to know about these past exposures and to know that there are certain diseases or health outcomes that people might be at greater risk of from those past exposures. So these medical screening guidance documents are intended to foster or support a conversation between patients and their healthcare providers. So this is the results table that was included in people's report back letters. Again, I'll kind of walk you through the components. So we're showing the results for 7 different PFAS chemicals. For PFOS and PFOA, there are different chemical variations. They still count as PFAS or PFOA, but there's slightly different chemical forms called isomers. So we summed those together. Some labs only just report all the isomers combined. So we have results for 7 different PFAS. As previously shown, we included here the NHANES results, so the median and the 95th percentile, and we matched by ages. So for an adult, we showed the results for people ages 20 plus in NHANES. NHANES has also done some testing of children as well of different age ranges. So for kids, their letters looked a little different because we compared their results to the appropriate age-matched group from NHANES. For people whose level of a chemical was above the 95th percentile from the general population, we did bold that to make that stand out a little bit more. That meant that the person's exposure to that chemical would be considered in the top 5% of the general population. And then we also calculated the sum of these 7 PFAS chemicals. And the reason that we did that is so that the results could be compared to certain benchmarks that were part of a report published by the National Academies in 2022. So we'll talk a little bit about that report. So the ATSDR and the National Institute of Environmental Health Sciences requested that the National Academies convene a study panel to help provide guidance on clinical care and PFAS exposure and PFAS testing. So the study report was published in 2022 and included experts in public health with expertise on PFAS, and they also talked to people from many different communities to understand the perspectives from PFAS-impacted communities. And the report suggested that clinicians should offer PFAS testing to people who want that kind of testing if they're likely to have elevated exposures to PFAS. It also provided guidance for interpreting the results of the PFAS blood testing based on the results, based on the levels of PFAS in each individual's blood. So just to explain the 3 main categories developed as part of the National Academies report. So for people with less than 2 micrograms per liter, again, that's same as parts per billion or nanograms per milliliter, the National Academies concluded that adverse or harmful health effects were unlikely at this level of exposure. I would say that barely anybody in the U.S. population fits into that lower level. Again, regardless of water contamination, we all can be exposed from food and consumer products as well. Most people fall into this middle category of 2 to 20 micrograms per liter, and the National Academies concluded that harmful health effects were possible in this sort of middle range of exposures. And their recommendations were pretty much to follow routine standard of care, such as screening for dyslipidemia, so that's cholesterol and triglyceride testing, for children and then for adults. Screening for high blood pressure in pregnancy, which is typical standard of care for prenatal care, and then following guidance for breast cancer risk as well. The panel concluded that there was some evidence, limited evidence of links between PFAS exposures and breast cancer. And then for people in the highest category, the National Academies concluded that there might be increased risk of certain harmful health effects. So in addition to the routine standard of care, some additional tests suggested were prioritizing screening for lipids. So again, for cholesterol and for triglycerides for patients of all ages, and conducting thyroid function testing, assessing for signs of kidney cancer, and then assessing for signs of testicular cancer and ulcerative colitis. So in terms of those three categories, so what I'm showing on the bottom bar is that in the general US population, pretty much no one falls in that lower category. The vast majority of people fall into that middle category of 2 to 20 parts per billion, and then about 13% of the general population is in that higher category of being over 20 parts per billion. In Hyannis, there was a higher proportion of our study participants who fell into that highest category, almost 3 times higher the percentage, again, consistent with the higher PFAS levels that we saw. So I mentioned that our PFAS REACH team has developed resources to help engage clinicians. So clinicians often haven't heard about PFAS before. These are relatively new concern. And a lot of times people who've gotten their blood tested for PFAS might bring their results to their doctor, and their doctor may not have had a chance to learn about PFAS. So our medical screening guidance documents are intended to support that conversation. We did a comprehensive review of authoritative government reports on PFAS and highlighted the types of health effects that were most likely to be linked to PFAS exposures. And so this had come out before the National Academies report, and the National Academies actually mentioned our guidance as a helpful resource for supporting patient health care. So for those of you who didn't take part in our study, if you weren't eligible or you didn't know about it, if you're curious about getting your blood tested for PFAS, sometimes clinicians are able to order a PFAS blood test for their patients. There can be challenges with getting insurance to cover the PFAS blood testing. And then there are also some options for individuals who on their own want to get their blood tested for PFAS. There's a home kit that people can do, as well as the opportunity to go to for instance, Quest Labs has the option for patients to go in to get tested on their own. And we have information on our PFAS Exchange website for people who are looking for this type of information. I think for people who are concerned about their exposures to PFAS, the most important thing is to think about ways to reduce our exposures moving forward. So this involves trying to avoid products in our daily lives that contain PFAS, so selecting products without stain or water resistance unless you really need products to have those properties, avoiding microwave popcorn and eating more fresh foods in order to avoid contact between food and food packaging, avoiding cosmetics or other products with ingredients that have fluoro in the name. If you're an avid skier, avoiding fluorinated ski waxes or floor wax that have PFAS. And in general, looking for products that say that they're PFAS-free. They can be hard to find, but you want to look for things that say PFAS-free and not just PFOA-free or just the name of any one of those chemicals. Because if it says it's PFOA-free, all it means is that it doesn't have PFOA, and there could be other PFAS. For those of you who want more tips about avoiding toxic chemicals in our everyday lives, I would suggest our Silent Spring Institute's app called Detox Me, which has ways to avoid PFAS and other everyday toxic chemicals. So just to wrap up here, what are our next steps? So right now we're working with our colleagues from ATSDR and from the other 6 sites to analyze the data. We're kind of just in the early phases. For now, we've been able to summarize the results of the PFAS blood testing. But of course, the really important work And the work that will take more time is to understand among people who took part in our study here in Hyannis and in Air and in the other 6 sites, do we see links between exposures to PFAS from drinking water and increased risk of different types of health effects? And so that work will take more time, and we will keep the community updated as we learn more. We will be conducting some additional analyses on blood samples from some of our participants here in Massachusetts, as I mentioned, additional PFAS testing and COVID antibody testing. We're working now to reconstruct past levels of PFAS in the drinking water in Hyannis to try to go back in time and to estimate what people's exposures and blood levels were in past years to get a better sense of the sort of chronic effect of exposures over time. And we will plan to provide updates to the community as we learn more. So I guess on social media, this would be too long, didn't read. This is the few take-home messages. So Hyannis is the community is part of a major CDC study. It's important to note that this is a very visible study. We have for the whole study combined, I think nearly 6,000 participants who are adults and about 700 children who took part in the study. So this is a really big effort, and the results of this study have the potential to inform policies and clinical guidance for years to come. In terms of what we learned so far about the results for participants here in Hyannis, we found that the levels of 2 specific PFAS chemicals, PFHXS and PFOS, were higher in Hyannis residents than in the general population and in Air. And again, the analysis of these results is ongoing, and we will continue to better understand through analyzing our data how PFAS exposures individually and in mixtures can affect our health. So with that, thank you so much. We have time for questions from here in the room and for participants who are joining via Zoom. If you need to contact our Hyannis study team, if you did not get your PFAS blood test results, please do email our study team. Thank you very much for your attention. We also, after the Q&A ends, would love to get your feedback as part of a survey. We're offering it in several different formats, so you can use the QR code and do it on your phone, and we also have some printed copies if that's easier. We'd love to get your feedback so that we can make future events even more helpful for you. So thank you.
Okay, thank you so very much, Dr. Shader. And Betty Ann Beavis, one of our volunteers and consultants, are going to pass the mic to whoever we call upon for a question. So we will now take questions from the audience. Does anyone have a question? Yes, your name, please. I'm sorry.
I'm Jane Walsh.
Hi, Jane.
Hi, I have several questions, but I don't want to take up if somebody
Yeah, if
else
we could
wants
limit
to go.
it to one question per person, and then we'll come back around
Okay.
to you if there's time. Thank you.
I guess I'll go with this general question. I see the participants were to have lived in Hyannis from May of 2006 to July of 2016. Where did you come up with that date? Like, what was the event that happened in May of 2006?
Sure. So according to the protocol that CDC and ATSDR developed, we were aiming to recruit people who lived in the area within the past 15 years. We had a kickoff event for our study in May of 2021, so they were sort of counting that as the beginning of the study. It took 2 more years to finish recruiting everyone, so there could have been people who hadn't lived in the area for, I guess, 16 to 17 years. But that was the thought, was to stay within that 15-year window. If people hadn't lived here for 15, 20, 25 years, if they did have exposure to the PFAS from the water, we wouldn't really be able to see that in their blood because the levels of PFAS go down over time. So that was sort of the reason for that early benchmark of May 2006. And then to be eligible, we were looking to recruit people who had been exposed when the water still was exceeding 2016 EPA health advisory level of 70 parts per trillion for PFAS and PFOA combined. After that time, the water still did have some PFAS as the Hyannis water system kept up with new regulations that went into effect at the federal level and at the state level. But after that point, none of the wells were exceeding that EPA guideline anymore. So that was the reason for that cutoff. It did make it for challenging recruitment. We talked to many people who were interested in being part of the study, but they had moved to the area more recently, and so they didn't meet with our criteria.
Okay, thank you. The reason I'm asking is because I grew up here and I've lived in Hyannis long before 2006, so I was just curious if that's when they started using the firefighting foam over the Mary Dunn well, or I could potentially have been exposed to the chemicals in that firefighting foam long before 2006.
That's a great question. And as I mentioned, part of our work will be to reconstruct earlier water concentrations. And so we do think that there were PFAS in the water well before 2006.
Okay, yeah, because my levels on that particular PFHXS, that firefighting foam chemical, along with everybody else in Hyannis, were elevated, but mine were extremely elevated. And so that's what I was curious about. How long does anybody know how long they've been using those foams over the well?
So in general, PFAS-containing firefighting foam started to be used around 1970. The Mary Dunn wells are pretty close to the Fire Training Academy, and unfortunately the water just moves in that direction. So it would take a little bit of time for the PFAS to move, but we think that's probably around when the PFAS first started to get into the drinking water. Some of the PFAS, the wells in different parts of the town. So the Mary Dunn wells are quite close to the Fire Training Academy. The Maher wells are down gradient of the airport. And then there are wells in more of the southern part of town, which probably didn't directly receive PFAS from the firefighting foams. But if the water had elevated PFAS, that means the people's wastewater did. And there are a lot of septic systems in the vicinity of those wells. So there are sources of wastewater getting into the ground as well. So those wells were probably impacted later. So our best guess is sometime in the 1970s is when the PFAS would have first reached the wells. And we'll, in a future update, share what we can estimate going back in time. We don't have information about how much foam was used or exactly when or which types of foam.
Thank you.
Thanks, Jane.
Okay, we'll now take a question from our Zoom.
Sure. We have a couple questions related to firefighting foam, so I think we can address those now. The first question is who manufactured the firefighting foam and how was it approved to be purchased and used in the Hyannis community?
Okay, great questions. So there were quite a few manufacturers of firefighting foams that made this type of PFAS-containing foam. 3M is one of the companies, and there were other manufacturers as well. So like I said, PFAS-containing foams, I think were first manufactured in the 1960s, but really started to go into widespread use in the 1970s. So fire departments in Hyannis and around Cape Cod had this type of foam. It was what was used for certain types of fires. Again, for training at the airport would require this type of foam because of the military specifications, and the FAA, the Federal Aviation Administration, followed the military guidelines and actually required training with PFAS-containing foam. So that was sort of in accordance with federal guidelines. The Fire Training Academy hosted fire training by fire departments from around the Cape. And so it was, PFAS were not on people's minds at that time. So fire departments were just doing the training that they were supposed to be doing. And they used the PFAS-containing foam at the Fire Training Academy to prepare for fires. It was totally standard for fire departments to use these foams at the time. Again, the military even required the use of PFAS-containing foams at military bases. On the Upper Cape, there are also PFAS issues from the use of PFAS at Joint Base Cape Cod. That's not reaching here in Hyannis, but for the same reason, because of these federal requirements. hope that answers that question. Thanks, Emily.
Okay, another question from the audience? Yes. Your name, please.
My name is Harry Alverson, and my question is Silent Spring, the CDC, or other regulatory agencies seeking to have the production of these chemicals entirely prohibited? And if not, is private litigation likely to accelerate that process?
Well, I can't speak for the CDC. I would say for Silent Spring Institute, we're definitely concerned about the widespread use of PFAS in many types of consumer products, and researchers at Silent Spring and many other scientists and regulators are moving towards restricting PFAS in general as a class, trying not to just restrict PFAS or PFOA or taking these chemicals one at a time, but adopting a class-based approach and phasing out their use, especially where they're not needed. We have these forever chemicals, and we've been putting them in dental floss and microwave popcorn bags. So there are a lot of uses of PFAS where they're really not needed. And there's actually a nice framework called the Essential Use Framework to help identify where do we really not need the PFAS and where are they not serving a vital function, where are they serving a protective helpful function, but there are substitutes, and firefighting foam is an example of that. There are now fluorine-free firefighting foams, and requirements have changed at the federal level to allow for training with water rather than training with the AFFF firefighting foam. And then there are uses where right now we don't have a good alternative. An example of that might be medical devices that contain PFAS. That doesn't mean they will always be essential for that function. There's always R&D to develop new products, and those might be where we reserve PFAS just for those really critical uses. So Silent Spring Institute in general supports the phase out of PFAS, particularly where they're not needed. And then groups like Mass Breast Cancer Coalition, I don't know, Cheryl, if you want to add about the work that MBCC has been doing to support legislation here in Massachusetts to ban PFAS in products. Do you want to say more about that, Cheryl?
Well, I think that it's important that we stay focused on research here in Hyannis with ATSTR CDC. And I invite everyone to please go to our website at mbcc.org, and you'll be able to see 2 bills that we're working on. But for now, I'm going to turn it back over to Dr. Shader and to Emma and to Emily. Another question from Zoom, please.
Sure. Another question about the firefighting foams. Are they still being used by the airport and fire academy here in Hyannis? And also, are there any future plans to test firefighters specifically for PFAS?
So the Fire Training Academy is not currently being used for fire training activities, so there's no new PFAS getting into the ground at that site. After our study was released in 2010, where we first found PFAS in the public water supply in Hyannis, the Fire Training Academy changed their policy to no longer allow for the use of PFAS-containing foams, although it's not clear that that was in reality that there were no more foams that were used based on some subsequent testing showing that some PFAS foams were still being used. And the question about the airport, I'm not actually 100% sure, but I think that I would actually have to double check about that, but I don't think that they are still using AFFF foams at the airport. Maybe someone in the back of the room, do you know if, Tom or Hans, do you know if they're still using any AFFF with PFAS?
Yeah, they'll have the compounds that the foam that's required under FAA there, but their training and use of it has changed drastically. They're doing it in a very contained delivery cart, so to speak. So they're no longer training with it and spraying it haphazardly in different places. But they're doing a very controlled experiment. So there's no real releases happening with it since 2015. But in the case that there is a tragic, catastrophic crash or something like that, it is on hand to be used.
Great. Thank you, Tom.
Sure. So this is more about exposure to the water prior to 2006 when the study started. If you were exposed to the water before 2016 when the water was treated, if you were exposed prior to that through the drinking water, do you need to be more careful than the average person in terms of avoiding PFAS in everyday consumer products?
So that's a great question. For PFAS, we think that the effects are chronic, and so the exposures that take place over a lifetime can really add up. So for people who may have had elevated exposures in the past, they might want to be especially careful to reduce exposures moving forward to sort of lower their lifetime total amount of PFAS exposure.
Hi, I'm Chris Greeley. I'm intrigued because I live in West Yarmouth, and a lot of the studies and the things they've been looking at in terms of water flow and things into the Mahar wells and everything, indication that there are problems into West Yarmouth. So I guess my question would be, are there any plans? I know that you very much targeted Hyannis, but there might be like a little broader because of the way the flow of water comes out of that whole area, the industrial area, the airport, and the firefighting facility. Is there any plans to do any more testing or to start to take a look at a slightly broader area that might be affected, such as West Yarmouth? Thank you.
Great question. Obviously, the water is all connected, and the water from Hyannis flows in the direction of Yarmouth. You're right that for our specific health study, we were focused on the past elevated PFAS in the Hyannis water system, and that's why we were focused on people who had lived here. From our studies work, the groundwater modeling that we're doing, I think will tell us more about how much PFAS might be in the groundwater headed towards Yarmouth. As part of a different study that we're a part of called STEEP, there was some testing of Mill Creek for PFAS, and I do believe there's other testing underway as well. It's an important question. The PFAS doesn't stop at the town line, and we do want to know more about where those PFAS ultimately end up.
Another question from our Zoom guests.
Sure. So this question is, are there other towns on the Cape filtering water to remove PFAS, like Hyannis? And the question, it says filtering well water. So I thought maybe we could also talk about the distinction between private wells versus public drinking water.
Okay, great question. So yes, Hyannis is not alone in filtering out PFAS from public or municipal wells. So for instance, Falmouth and Mashpee both have had public wells contaminated by PFAS coming from Joint Base Cape Cod. So the Air Force is actually paying for the treatment of some public wells as well as some private wells in that area that impacted by the plume of firefighting foams coming from Joint Base. In Chatham, I know that they also had at least one well that was over the state standard, and that well it's been turned off, and I don't know the latest about whether treatment has been put in place on that well or if it's offline. But certainly there are multiple towns across the Cape that have put in place treatment for PFAS, and the EPA in April issued new standards for PFAS. So here in Massachusetts, we've had a standard of 20 parts per trillion for the total amount of 6 PFAS. So that went into effect in October of 2020. So that means that here in Massachusetts, all public water supplies have had to test for PFAS, and if there's been exceedances of that standard, to take steps to mitigate and filter the water or find other solutions to meet that standard. The new EPA standards set, rather than taking a group approach, set standards for 5 individual PFAS, as well as a combined measure called a health index. For PFOS and PFOA specifically, they set the level at 4 parts per trillion. So I do think there may be additional water supplies that will now have to put in place water treatment because of these new standards. Barnstable Fire District, I know, is also putting in place that they either have put in place or will be putting in place treatment because they also have exceedances of the state standard. It's a really important question to think about private wells as well. There aren't many here in Hyannis, but across Cape Cod, about 20% of residents rely on a private well. And by and large, there's no required testing for PFAS or really for any contaminants in private wells, with some exceptions at the time of property transfer. Silent Spring Institute first tested for PFAS and other unregulated drinking water contaminants in private wells in 2011, and we did see PFAS coming, we think in many cases, from septic systems in private wells across the Cape. And we've done 2 rounds of follow-up testing more recently as part of our STEEP project, which is led by University of Rhode Island and also includes Harvard and Silent Spring Institute. And I'm happy to share resources about our STEEP findings as well. We did find that PFAS were common in many of the private wells that we tested, particularly wells with higher levels of nitrate. The largest source of nitrate in Cape groundwater is from septic systems, so we think that all the products in our homes that contain PFAS, traces of those can end up in our wastewater, and so that's why we see links between PFAS and nitrate and other wastewater markers. And the county lab can help you get PFAS testing for your private well if you'd like.
Hi, Betsy Young. I am wondering about sort of therapeutic results or information we could get. You had talked about menstruating women. Can I go to my doctor and say I'd like to have therapeutic bloodletting, like to maybe in a more modern term, but is that something that could be effective and lower my numbers?
So this is a question that we hear from many people who've found out that they have elevated PFAS in their blood. So because PFAS bind to proteins in our blood, if we, as you mentioned, with menstruating women, lose blood, that means that we're able to lose some of the PFAS from our bodies. There was a study in Australia, I'd say a year or 2 ago, that looked at phlebotomy and found that donating blood did lower the levels of PFAS in the firefighters in that study. I don't have the numbers off the top of my head, how many times they donated blood and how much that lowered their levels, but that would work. I don't think we're at the point where a doctor would prescribe that. I think we don't know yet how many times you would donate blood and how much of a difference that would make. And there's obviously some risk involved with donating blood as well. But in theory, that would work, and I think that is one thing that researchers are looking into. Another possibility, I guess, is a certain medication called cholestyramine. So this is a drug that used to be used for cholesterol. Researchers who conducted the C8 study, so if you watch the film Dark Waters, this was conducted in a study in West Virginia. And as part of that study, they asked people what types of medications they were taking. And some people in the study were taking cholestyramine to regulate their cholesterol levels. And for those people, they had very low levels of, I think it was PFAS specifically, in their blood. And so the idea being that the cholestyramine could help the body more quickly excrete the PFAS. And there was a clinical trial recently that was published earlier this year that did show people who took cholestyramine could lower the levels of PFAS in their blood. Again, that was a small clinical trial. I think it's not something that that doctors would necessarily prescribe, but it's something that in theory could work. It's been shown for some PFAS. I think it works better for some PFAS than others. And I think it's an area of active research. But it's not like high blood lead in kids where there are chelators or, sort of solutions to easily lower levels of PFAS in people's blood. They do go down gradually over time, and I think it's important for there to be more research to learn about ways we could speed that up.
The next question is, are there any future plans to test firefighters in particular for PFAS levels?
So, as I said, we were not able to include firefighters as part of this study. And that is of a topic of interest for Silent Spring Institute. Some of our colleagues at Silent Spring are doing some research to better understand exposures among women firefighters in San Francisco compared to women in other occupations. And there are other studies underway of PFAS exposures among firefighters, as well as PFAS exposures in fire stations. And I do think that's an important area for future research.
Back to the filtration, just wanted you to talk a little bit more about what type of filtration is being used and how our water is being tested currently with the how it compares regarding the new maximum contaminant levels from the feds, and is it? I've heard reverse osmosis. I'm just more curious about how the levels are now and what kind of filtration is being used now for Hyannis water.
Okay. I'll give one answer, and then we have the Hyannis Water Superintendent here, so he can add on to or correct what I say. So all of the public wells in Hyannis, the water from all of those wells pass through activated carbon systems. So picture a 20-ton Brita filter. And so activated carbon is very effective for filtering out long-chain PFAS, PFOA, PFHXS, PFOS. And so the levels of those PFAS are non-detect in the treated water in Hyannis, and so the water is in compliance with the new standards. There are some of these newer alternative PFAS, so particularly short-chain versions of PFOS and PFOA, and they're in general more mobile, and they have an easier time getting through filters. So those short-chain PFAS can make their way through the filter over the lifetime of the filter, but they are not currently being regulated at the federal level. I think that at this point it's important to monitor and to know what the levels are as we learn more about the health effects. There are some guidelines that have been developed by states, and they tend to be at much higher orders of magnitude than the sort of single-digit standards that the EPA put in place. And I'd love if Hans Kaiser, the Hyannis Water Superintendent, if he wants to add anything to that or not.
Hans Kaiser, Hyannis Water System. Laura pretty much said it. All our wells are being treated or filtered through activated carbon. And we test the wells before, during, and after the filtration process. And all of the after filtration process testing comes back no detect. So I think even though the EPA proposed standards are much lower than the current Massachusetts standard, we are in a pretty good shape to be able to comply.
Well, I think I would like to thank Silent Spring for all the work they've done here with, CDC, ATSDR. We were the ones who received the federal appropriation to help start these studies, and we're so grateful that we have these awesome partners in this process who can get into the communities and do the outreach and get lots of people recruited for these studies, because collectively I think this information will help us all gain a much richer understanding of these exposures and what they mean for community members across the country. And even if you're a community member who's not in one of these communities, because we know there's lots of communities that have these exposures, the information we're learning from these communities will hopefully help answer questions for other communities. So I'd really like to thank you for all the work you've done. I think it's awesome, and we are anxious to see what happens when all the data gets analyzed. So thank you so much.
Well, thanks to you and to everyone else at ATSDR and CDC for supporting us in doing this work and for being great partners for doing this.
Sure, and I just want to echo that thank you to the community. I've been kind of working behind the scenes on the team and just what important research this is and couldn't be done without the participation of the community. So thank you.
Thank you very much, both of you. Do we have any other questions from our Zoom friends before we close?
We do have a few more questions. So the next one is, what was the criteria to pick the specific towns throughout the country for the overall study?
So when ATSDR put out the call for proposals, they had some guidance about what we were supposed to apply to be able to do, the sort of target number of people for us to recruit. But we could choose the communities that we wanted to work with, and so we chose partners where we had existing or developing relationships, and we put together all the information that we had and we submitted it to ATSDR. And I don't know how many proposals they received, but they had funding to support 7 studies. And so they considered the towns that were chosen by the researchers, the likelihood of being able to meet the recruitment goals. Some communities like here in Hyannis had higher PFAS and PFH excess. There are other communities with industrial sources that had higher PFOA or PFNA. So I'm sure there was sort of an effort to pick different exposure sources, some geographical diversity, but I wasn't part of that decision process. We just did the best job that we could in putting a proposal that we thought would fit within the study. Tara, I don't know if you're part of that or want to add on to that.
Yes, so when there was a call for proposals that went out across the country and various research organizations put their proposals forward, so many are like tied to a university. If you go to our website, you can see all the sites that were selected and learn a little bit more about those communities. I was not part of the selection process, so I can't tell you anything about the details of how that worked out, but it was like a competitive process with multiple agencies across the country applying, because I think there are lots of communities that have been impacted. So I think we hear, that from communities, like we want to be part of the process for helping understand, like we would like to be included in these studies or exposure assessments that you're doing so we can learn more. And so I think, unfortunately, we have many, many communities who were likely eligible, but we had to narrow it down to what we can support.
Thank you. With respect to time, it's now 1:32. Dr. Shader, would you like? Oh. With respect to time, it's now 1:32. I understand that there are some people that need to get back to work. But if you'd like to stay a little longer, Dr. Shader, would you be willing to answer a couple more questions? Okay, thank you so much. Let's take another question from Zoom, please.
Sure. This is going back to the short chain PFAS that you were talking about. If there's still a chance that short chain PFAS are getting through the water filters, can we still safely drink the water?
As part of the current UCMR 5 testing, so that's the unregulated contaminant monitoring rule, cycle 5, which includes both short chain and long chain PFAS, there are some detects of some of these shorter chain PFAS. And Hyannis is not alone. A lot of water systems that use activated carbon have small amounts of these newer PFAS breaking through. As an added precaution, if people are concerned about having any detectable PFAS in the water, it is possible to filter out these PFAS, for instance, with a reverse osmosis system. I would say that these are also chemicals that are found in many everyday products as well, and so water is just one way that we can be exposed. So it's important to think about all of the products that we use every day, as well as the water that we drink. And like I said, the guidelines that have been developed by other states for these PFAS are typically at much higher orders of magnitude. So based on what we know for now, the water would be in compliance with all of these different state guidelines, but we continue to learn more, and I think it's important to stay aware and monitor these levels over time.
question from the audience?
Hi, Gretchen. I worked with you years ago on a different Silent Springs project, but I'm just curious if any testing's been done on bottled water and if there are like particular companies' water that is better or worse for PFAS or any number of other things.
That's a great question. So unlike public water, which is regulated by the EPA, bottled water is regulated by the FDA, and there is not routine testing for PFAS in bottled water. The state has compiled information voluntarily provided by bottled water providers. Not surprisingly, they all came out with non-detectable PFAS. I know there are some sporadic issues with PFAS in bottled water. For instance, there is a bottled water company in Haverhill that was discovered to have high PFAS levels. So in general, if people are concerned about PFAS in water, we don't point them to bottled water unless there's sort of an immediate need to provide PFAS-free water because there's no one sort of checking for PFAS. And there are a whole host of other concerns about bottled water, including sustainability and the petroleum needed to make the plastic water bottles and chemicals from the bottles themselves that could leach into the water. So thank you for asking that question. And good to see you.
Dr. Shader, thank you very, very much. We're so lucky to have you working with us here on Cape Cod and beyond. You truly are a shining light to so many, providing all of us with hope with the great teams that you pull together. And thinking of all the years we've worked together, I have to personalize it a little and say I'm honored. Thank you very much. I'd like to just share with everybody that we will have another program here this evening at 5. It will be the same exact program, but if you have further questions, you can certainly join us via Zoom, or I'm going to turn it over to Emily to share how you can get in touch with us to ask further questions. Emily?
Sure. So if you have further questions that we were not able to answer today, please feel free to email us at our study email. It's PFAS, PFAS-health-study@silentspring.org, and that will also be in the Zoom chat. You can see us afterwards as well. Thank you.
Thank you, everyone, and remember why we're doing this. Our children, future generations. Thank you very much. Have a good afternoon.